Medicare is one of Australia's most loved institutions, but right now, Medicare and Australia's healthcare system as a whole is in crisis. Government neglect, the increase of chronic illnesses and the ongoing COVID-19 pandemic have led to widespread workforce shortages, rising individual costs, and growing inaccessibility. Without urgent reform, our universal healthcare system might become a thing of the past. Medicare funds Australian healthcare in two main ways. First, it directly funds our public hospitals, meaning that when you go into a public hospital, you'll be treated for free. Second, it provides rebates for individual services provided by private hospitals, clinics, or GPs. These are either paid directly to the service provider, which we call bulk billing, or to the patient to partially reimburse them after a service they've paid themselves. Today, Medicare is facing a crisis. Federal Healthcare Minister Mark Butler has said the system has never been in a worse state. At the heart of this crisis is general practice, your GP. Visits to your GP are meant to be the backbone of Australia's healthcare system. But at the moment, GP appointments are harder to get when you need them and even harder to get for free. So what changed? Australia has an ageing population and just emerged from a pandemic, among other things. This has put healthcare workers like doctors and nurses and equipment in higher demand, thus driving up costs. But as the cost of a GP visit has increased, the Medicare rebate, that is the lump payment Medicare provides per appointment, has not kept up. Over the last decade, the cost of a GP appointment has gone up by over 30%. The Medicare rebate has only gone up by 12%. This means that GPs are making more and more patients pay the difference out of pocket, making free GP visits much harder to find. And the problem is set to get even worse. With increased demand and decreased compensation, combined with the experience of a pandemic, many GPs are leaving the profession. In fact, 1 in 4 GPs plan to retire within the next 5 years, and half of all GPs don't expect to still be practicing in a decade. On top of that, most medical students don't intend to become GPs. Today, only 15% of medical graduates will go into general practice, down from around 40% in the 1980s. Because it's harder and harder to get a free appointment with a GP, lots of people are seeking treatment at public hospital emergency departments, even if they don't have emergency conditions. This is overwhelming the public emergency departments and dramatically driving up wait times. At the moment, 1/3 of emergency department patients wait over 4 hours before being seen. Medicare's crisis is structural. Even at the best of times, it's designed to support individual one-off appointments. For an aging population with increasing rates of chronic health conditions that require ongoing care, this just doesn't work. So what needs to change? Well, there's no easy solutions to the crisis in Australian healthcare. While increasing Medicare rebates might stem the decline in general practice, it wouldn't fix Medicare's structural problems. Australia needs serious, widespread reform to strengthen Medicare, including large-scale planning to address workforce and equipment shortages. This will take political courage, but the right to public healthcare should come before corporate handouts or tax cuts for the rich. If you'd like more information on the Medicare crisis, check out the fact sheet on the Carmichael Centre website.